Hey guys, welcome back. For those that are new here, my name is Melanie and I have been kind of sharing, documenting my cancer journey, and we are now at another, not crossroads, I guess that's not the right word, we're at another big hurdle, and hopefully the last big hurdle, because my scans came back. I am still cancer free, which is just such a relief. I was really anxious this time, not as anxious as last time, but I still just had underlying anxiety. Like everyone else was like, it's going to come back clear. And then for some reason I was just having like, well, what if it doesn't? And thankfully the scans came back clear. There is one thing that they're wanting to take a closer look at with an MRI. So I'm going to have an MRI on Sunday to look at the dura. They think that it is just thickening of the dura from post-surgical changes, basically. Post-surgical changes to that area as well as post-radiation changes to that area. But they want to be 100% sure, so hopefully that comes back with what they're claiming it is, and there's nothing else going on there, no cancer there. Everything is showing cancer-free, so hopefully that is going to remain the case even after the MRI, and this is just something that is now a new feature of the inside of my skull. But I know I have been talking about a tentative surgery, telling you I would update on that, and we now have a pretty firm update. The MRI could possibly change it, but very, very doubtful. Either way, surgery has to happen. The MRI will probably only change how it might happen if there's something there. But as I've discussed in other videos, the hole that the radiation burned in my skin flap has just gotten larger. So if you're squeamish, I am going to go ahead and take the patch off to show everyone. It'll help for talking purposes, but it's not, as you can see, it's not oozing or anything. It's just very large. Like, I can stick my finger in it. And should I be doing that? No, I should not. So I've been having to be I've had to have a lot of self-control, because especially for those of you that might be like pickers, you get a blemish and you just can't leave it alone. Having a hole in your eye that you can see into is really hard for people like that, like me, to leave alone, especially when you're still required to rinse your nose out, and because your eye is connected to your sinus cavities, stuff comes out your eye, and I just want to get it out. Like, I want to get the rest of it out that I know is in there. And so I would get a Q-tip, I would kind of clean out the perimeter, get all the gunk out, basically, and my surgeon is like, what have you been doing to your eye? And I told him, mostly because my best friend was with me for that appointment, and she was like, be honest. And so I told him, and he was like, stop all of that. And he was like, leave it alone. It's supposed to look gross like that in there. Like, that is protecting areas in your, basically, it's protecting my skull. And the biggest issue is it is also protecting the area where they removed my skull when they had to access the dura because of part of my tumor that was going up into the dura. Thankfully, there was no cancer like going into my brain. The dura also came back clear, but now that part of my skull has been removed, and so my dura is just protected by the lining of like what's in my face. And originally with the first flap surgery, it was taken from my forearm and fat was used. Well, the radiation caused the fat to fall, which then opened up the cavity in my eye to my sinuses, and so it was filling up with the same inflammatory stuff that my nose was filling up with from radiation, and it had no way of escape because the fat fell, closed off the drainage to my nose, and between the radiation just burning a hole in my skin anyways, and that liquid needing a way to escape, a small, tiny pinprick hole formed. And we thought maybe it would eventually close on its own once the drainage stopped. Then the possibility of trying hyperbaric oxygen to see if that would help, that was a possibility. My surgeon did not want to do another surgery, especially this early. Surgery is now not even tentatively scheduled anymore. It is scheduled for October 15th, so 2 weeks from now. And that's only 6 months out of radiation. So my skin, the blood vessels there are still really sensitive because of all the radiation I had, and it makes surgery a lot riskier. So post-radiation, when I had my surgery, the risk of the flap failing was like 2 to 5%. Obviously, it failed, not because this flap failed, like it's still getting blood flow, but because the radiation caused the hole. So 2 to 5%, I still have to have another surgery. Now, though, the odds of the flap itself failing, like the artery not being able to keep the blood flow going and the skin flap alive, basically, is 20 to 30% because I've had the radiation. So the risk of failure is going up, but in my mind, not that that's great, but I've been hitting all the 2%. Like the chance of me having the cancer that I had, 2%. The chance of this happening, I don't know, 5%, not very high. There was something else that was like really low percentage of it happening, and it happened. So I'm like, I probably have better odds if the odds are higher. So I'm going into this really optimistically, hoping that I'm not going to be biting myself in the foot. It is not going to fail. 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 But for those who haven't been watching all along, if you have, feel free to skip the next little bit. I'm just going to kind of explain what happened and then where we're going next. So I had a nasal squamous cell carcinoma. I was diagnosed when I was 30 weeks pregnant. We delivered the baby early. I started chemo. The chemo worked really well and got rid of the majority of the mass that was sitting here in my sinus cavities and going up into my dura. So that all responded to the chemo. However, I had a part of the tumor go into my eye orbit, and that part did not respond well to the chemo because your eye just doesn't get as much blood flow, and chemo needs blood flow to do what it is supposed to do. And so after my 6 rounds of chemo were up, I still had tumor here. And so we thought we were going to do radiation to take care of the rest of it. But basically the radiation doctor was like, radiation is literally going to melt your eye anyways. It's going to be extremely painful. It's not going to be a functional eye. It's going to be gross and the best thing. And then you're going to need to get it removed after because of how bad it's going to be. The best thing to do is to remove your eye before radiation because the outcomes of surgery are better before radiation. So that is what we did. Removed my eye. He used the forearm flap so that it would be, smaller like this. But when they were in there to remove the rest of the tumor and put the flap in, the surgery actually ended up going over like by 2 hours because he kept finding more cancer than was expected and having to go deeper and deeper to get clear margins. And because of that, it then changed the plan for radiation. So originally I was only supposed to have proton radiation only to like my sinus area. And basically everywhere there was a tumor. Because of what he found in the surgery, he did get clear margins, which I am so grateful. He worked really hard for me, and I'm grateful for that. But because of what he found, the radiation plan changed, and I had more radiation than originally I was going to. And it was not just proton. I ended up only having 2 weeks of proton radiation. The rest of it, before that, I had a total of 8 weeks. Either way, it was a total of 8 weeks because it was 6 weeks of regular radiation. And then 2 weeks of the proton radiation. And yeah, my skin, obviously, it just continued to shrink my skin flap, and it just shrunk it too much. When my skin flap was first done, it was bigger and bulkier. It looked like I had a golf ball, like, sitting in my eye. And then over time, the nice thing about the radiation was it did shrink it, but then it kept shrinking it and burned a hole in my skin. Like I said, my surgeon was like, just wanting me to kind of live with the hole, and at least for a while. And I was like, I cannot be someone with a hole in their eye. I want to take my daughter swimming. I want to put my head underwater. I want to take her whitewater rafting one day. I want to take her on water slides. And I know that's years from now. She's 1. But in my mind, like, that's the kind of mom I want to be. I want to be an adventurous mom. I want to, all of those things. Sorry. So we looked into a second opinion. Oh. Hello, YouTube ads. Skipping 50 seconds. Bless it. Just watch whatever that is. I've lost my train of thought. Yes, he didn't want to do the surgery. He was like, just keep a patch over it. But we went and got a second opinion, and by that point, it had been a while since my surgeon had seen my eye, and then this surgeon saw my eye, and she was like, no, you cannot leave that open. It's too exposed to the elements. It's drying out. I can see some of your skull, which I didn't realize you weren't supposed to see. And she wanted to close it off, basically, to my sinuses. I would have another skin flap. She was like, we'll do a complete new skin flap surgery from your thigh. And I was like, oh my gosh, a whole nother flap surgery? Like, what? I just thought they could stitch it closed, like add some skin, like not real skin. Like, can't you just, because for real skin, you have to do a flap because you need to be able to keep that skin alive. But I was like, can't there be some like fake skin that doesn't need to be kept alive that you can just sew on there somehow? But no, it doesn't work that way. So she was wanting to do a whole new skin flap surgery, close off the area, close off the connection between my eye cavity and my sinuses. And I was like, do we do that? You know, do we go with her? Whereas like my surgeon knows my history. I've trusted him. You know, I had people reaching out saying, your surgeon messed up. Like that shouldn't have happened. He should have compensated for how much radiation you were going to have. But we didn't know how much radiation I was going to have. So he did compensate for what we thought was going to happen. And me, I think being young, he was trying to make it as aesthetically pleasing as possible for me living, hopefully, a very long life with a skin flap for an eye. And then, you know, what happened happened. And radiation burns holes in people's skin all the time. No matter, like, in your jaw, and it's crazy, the things that you learn, the things you see, being, you know, in a cancer radiation room, waiting room with other people. Just radiation is brutal and does things like this. So my husband feels confident with our surgeon, and by the time we went back to him and he was able to see inside, he was basically the same opinion. You have to have the surgery. You should not be seeing skull. The skull should be covered with lining, junk, I don't know. And he said, and your dura, where the skull was removed from my dura, he didn't even want to mess with it. He's like, if I mess with this, he's like, I could potentially put a hole in it, causing a spinal fluid leak. It's very thin. So he doesn't want me like bending over very much. And he said, you need to stay out of your eye, because if you put a hole in it and cause a CSF leak, that could then lead to meningitis, and that just creates a whole new avenue of issues to be able to do the surgery. So I'm doing the best I can. Some days are harder than others to stay out of my eye, but I'm doing the best I can and just kind of floating through. We have 13 more days. I just have to make it 13 more days without doing something to that lining of my dura. But basically, when you look inside my eye, you can see basically my brain, not my brain, you can see that lining that's protecting the dura, but you can see the pulsation of my brain because of how thin that lining is. And so that's what he's worried about, and that's why we now have to have the surgery, and we have to have it now. Because the longer that goes unprotected, the more chance I have of developing a hole, getting meningitis, like not good things. So while I'm grateful, he's now like, no, we have to do the surgery because I wanted the surgery. I'm also nervous because it is early on in terms of my skin could technically use more time to heal. He said from the previous surgery, I guess I have very small veins in my face, and it made it hard for him to get that connection. So they take an artery from wherever they're taking the skin from. They take an artery and use that artery to connect to the flap so that the skin for the flap stays alive. It needs blood flow. But my veins are really small, I guess, and so that was difficult for him last time, so he's worried that's going to be difficult again. He won't really know until he gets in there because the veins could have gotten a little better. Chemo tends to kind of shrink and cause issues with your veins, and because I've been 6 months out of chemo as well, they may have had time to get somewhat better, but obviously that's not a lot of time for them to get better. So the new plan is stay out of my eye and surgery on October 15th. And what that is going to look like he sat me down, and my surgeon is, for the most part, very like, everything's going to be okay. Just stop looking at the internet. Stop doing this. But you're going to be fine, and we'll do this, and it'll be okay. And he's never really like gotten very serious with me, in the sense of like, even when he was telling me about like the potentially poking a hole in my brain, basically, my friend was like, could she like rupture her brain? Wanting him to just say yes, because she wanted him to scare me. She was like, oh, no, she's not going to rupture her brain. She'll just cause a leak. And just kind of said that just like that. And she was like, oh, I needed you to terrify her. But he did get serious in that meeting, because he said, there are two options. We can take another forearm flap, or we can take a flap from your thigh. I did not want another forearm flap. This thing is, one, the healing of this was a pain in the behind. And it still is not limiting, but it gets tight. It's not like, and it's right here. I did not want another one on this arm. This is my dominant arm. Didn't want that. I wanted to do the thigh. And he said the thigh is the best option. He's like, but it is going to be big. It's going to be large. It's going to be larger than this. And I think he's worried that I'm not prepared for that. And I think I am. I've looked up pictures. People have sent me pictures. There's a girl that lost her eye. She has a huge flap that goes all the way. You may have seen her on TikTok. Hers is like huge and goes all the way here. And then it's like kind of out pretty far. Pretty bulky. He said it will not be as big as that, because they're not going up. It still will only go to right here. And then I found a gentleman who his starts right here, but then it goes really far down into his cheek, like about here, and then it's pretty protruded. Dr. Mackey said he's like, it could look like that. He's like, first he was like, where are you finding these pictures? Stop looking at the internet. And I was like, I need to be prepared. I was like, as long as it is going to look no bigger than this, I am okay. And he said it should not look any bigger than that. And then eventually it will shrink. It's just going to take a lot longer to shrink, because the radiation, one of the pros of the radiation is it does shrink your skin and that fat fast. It just, for me, it shrunk that fat really fast, too fast. So when they took from the forearm, it was skin and fat. This one they will be taking from my thigh, and it is muscle and then just a little bit of skin. And I did this in the live I did, but I was sitting in a chair. We'll see if I can do it here. You can see here, this was the just small skin graft that they used to put over this after they took this skin out. For my thigh, what they will do is they'll cut a pretty long incision. So they're going to take a full strip of muscle, and it'll be a long incision, and then right here in the middle, they'll cut a circle of skin and then continue up with the incision. But because there's enough, like, give in your thigh, all he'll have to do is close it over and just stitch it. So I'll just have one really long scar, as opposed to them needing to take another skin graft. So I won't have to lose another skin graft part of my body. So that's positive. And he said the recovery for the thigh and the recovery for the thigh is a lot easier than the recovery for here. So I am hoping that after the 2 weeks and I can get back to picking her up and all of that, the recovery won't look as rough as last time. Because last time I mean, last time I had about 2 weeks after surgery before I started radiation. And I remember there being a window of time where I could help and do more with her. But once the radiation started, it was just a living nightmare. And I just pray, I'm praying that that's not where we're going. We're not going back to that. It's going to be a setback. It's going to suck. I'm going to have to spend 7 to 10 days in the hospital. So I'm going to have to be away from her. And she's older now and she understands that, when Dad or I are not around. So that's hard. But I'm going to work really hard on using that time in the hospital to just heal as much as I can so that when I come home, I'll still be healing when I get home, but I hope to be pretty healed so that I can be attentive with her, start being as hands-on again as soon as possible, because we're in a really good place right now. And I think we're going to get back there quickly, but Babe is really worried that that's not going to be the case. In his mind, he thinks it's going to be another year before we're back in the place we're at right now. And I was like, no. It will not be like that. I do not have radiation following this. In my mind, at most, by Christmas, my goal is to get Disney passes. I wanted them for her birthday. Obviously, that didn't happen. By Christmas, we will get Disney passes. That's my goal. That gives us 3 months to let my body heal, recover. I know it'll still be recovering even then, but I think I will be well enough to do those things, to take her to the library like I'm doing now, to go do things during the day like we're doing now, which has been really good for my mental health. That's what I need. I need to be able to get back to those things as quickly as possible. Because the mental game in all this is honestly worse than the physical game. Just, at least for me, it has been. And even with all of this crap going on, I just don't want to go back to how dark it got during radiation and after that first surgery, because it was rough. It's really rough. And at some point, I plan to do a video on that, talking about cancer and mental health and all of those things, but that's for another video, because this video has now gotten 30 minutes long. I'm sorry, guys. But I think that's it in terms of where we're at. The next time, maybe not the next time you see me, but I may share some videos from the hospital. I may not. Last time, after my first surgery, I didn't look at myself for 3 days. Eventually saw myself in the reflection of a paper towel holder. And that girl is not up. She's trying to be up. She's not up. I hear her. Go back to sleep, girlfriend. Anyways, I saw my reflection in a paper towel holder, and I was like, okay, that's where we're at. And it was very disorienting. Body dysmorphia was an issue for a while, and still I have those issues sometimes, but I think because I've already gone through the process of getting used to this being a look, I think I'll be okay. So I plan to look at myself the day after surgery once I'm lucid, and just start getting used to my new normal as quickly as possible, because I think that'll be the most helpful for me, just to see how big it's going to be and go from there. So like I said, depending on how I'm feeling, I may make some videos in the hospital, I may not, but I'll definitely keep everyone posted once I can. If you follow me on Instagram, I'll probably share more there while I'm in the hospital, just because it's a little easier. So Life's Sweet Journey is my Instagram handle, and I tend to share on stories there a good bit, and probably will from the hospital. Last time I was in the hospital, I didn't touch my phone, but I think this time is going to be different. I really do. I really think this time is going to be different. I'm going into it more mentally prepared. I've been through it before. I know what it's like. The only thing I'm not really prepared for is being away from her, with her being as old as she is. I'm not looking forward to that. But Andrew's going to bring her by every afternoon after the first 2 days. So I'm going to have surgery, have a recovery day, and then based on where things are at on Thursday, he'll bring her. If I need another day, he'll wait one more day, but I'm hoping I don't need another day because I want to see my girl. I'm hoping it doesn't bother her. She's starting to understand more because she sees me like this, and then at home, for the most part, before last week, I was just like this. So this is how she was used to seeing me. But Dr. Mackey wants me wearing a patch pretty much 24/7, so I should probably put it back on. Pretty much 24/7 when I'm at home, just one, to keep me out of it, to keep stuff out of it, because that's also a risk, is the risk of infection. And so I don't, keeping a hole in my eye means risks of infection all the time. And so that's another reason to get it closed. But once I started putting the patch on at home, she's been looking at it, touching it. She's just curious. So I hope she, comes in and doesn't feel like that's not my mommy, or is scared to come, hug me, let me cuddle her. I don't know. We'll see. But yeah, I think that's it. I would really welcome any prayers, vibes, that the surgery goes well, prayers for Andrew and the baby while I'm gone, and mostly just prayers that it takes, that it does not fail. Please, please, please do not fail. Please do not fail. And please let me wake up. Yeah. All right. Thank you for watching, for sending all the love that you send. It really means so much. Bye, guys. Until next time.